Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Angelica Film Center Mosaic in Fairfax, Virginia on Sunday, January 26th at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, waiting for your phone calls and to discuss some very interesting information with you today. We're here at 888-630-9625, 888-630-9625. Love to talk to you on any subject that you've had in mind. Any problems that you've had that you've tried, you've applied all kinds of remedies that don't seem to work. Well, here's an opportunity to find a natural spin on it without drugs, without surgery. Love to fix that for you. As always, if you'd like to talk to us other than on the program, you can get a hold of us by going to drtomroselle.com or rosellecare.com. That's ROSELLECARE.com. And send us a note and we'll get back to you. If you'd like to do that, by voice contact, call us at 703-698-7117. Anyway, I'm in studio, and it's a beautiful day outside. It's gorgeous. And here sitting next to me to discuss a very interesting topic is Dr. Stephanie Pina. And the topic that we're going to discuss is homeopathic and Chinese medicine, the similarities, what they're about, the crossovers. And interestingly enough, Dr. Pina published quite a substantive paper in the Townsend newsletter about a year or so ago, I think. And she'll straighten me out in about 2 seconds as soon as we go. But we're going to talk about the energetic medicine and how it affects your life and what it means to your health. Anyway, Dr. Pina.
Nice to be back.
Nice to be back. It's always fun. You almost had your hands full today.
I know. I got it all ready for you, ready to go. I was good. I was ready to start the show.
Yeah, this was what we're talking about. I was in Chicago all weekend teaching at the National University of Health Sciences, and I literally got off the plane at Dulles Airport at 11:20 and made it so we could broadcast. And I just walked in, put the headset on, and she's getting a pro at this. I'm going to just have to kind of turn over the microphone and let you do this all the time.
We'll just have to change the name, the doctor.
No, we're not
Dr.
changing
Pina
anything.
show?
No, we're not changing anything.
Okay.
We can make it the Dr. Tom and Stephanie show.
We'll work on that.
Okay. Well, see, in the alphabet, QRST. No, I'm not going to get. No,
Yeah.
no, it's
No,
not.
it doesn't work in your favor.
It doesn't work. Oh well, I tried. Anyway, That's neither here nor there. No, this is a very interesting topic, and it's one that, when you stand back and you look at what is, a German principle of medicine have to do with Eastern medicine, and what it comes down to is they're both energetic.
Yeah, homeopathy and Chinese medicine is something that a lot of people see as individual types of medicine. They have so many similarities together that, basically you can kind of take some of the same principles of this whole idea that there's energy in the body and that if it's in balance, we can function, we can live, we can survive. And when we're not in balance, it's going to reflect into symptoms. Chinese medicine and homeopathy both look at that differently. It's two different types of treatments, but essentially they're still looking at trying to balance the person and really look into what's going on. It's all about observation.
Chinese medicine is thousands of years old, and the essence of homeopathic applications came about by a guy by the name Samuel Hahnemann. And that wasn't that many years ago compared to Chinese medicine.
Yeah, compared to Chinese medicine, absolutely. But what's interesting is if you look at it from a historic standpoint, I mean, they both kind of have bases and roots, and the same thing was going on in each time. You know, if you look at Hahnemann's case, you know, around that time, bloodletting and using toxic forms of not herbs, but some herbs, but also metals and stuff, materials, were basically the things that were being done, and you know, people were getting better from it, or they were getting better because they were no longer alive. And so the toxicity factors were really high.
The problems are over with at that point.
Those symptoms,
right,
you know.
No symptoms. You don't have to worry about it at all.
Exactly. So there was, you know, it was a win-win, I guess. And in Chinese medicine, when it really started to develop and flourish, and you saw more practitioners go from the lay practitioner to starting to treat emperors and the court, I mean, they were going through times of famine and struggle and war and bringing in new disease and whether or not they were going to be able to feed, you know, the countrymen. So you have situations where basically neither one of these current medical routines were effective. They just weren't working. So when Samuel Hahnemann and those that were key in Chinese medicine came about and started to develop these two types of systems, they started to go, there's more to it than just what meets the eye. There's more to the person than just giving them something to kill something off. And there's more to them than just kind of saying, well, eat, rest, and sleep. That's important, but there's got to be something else in there that really individualizes the treatment for them.
Well, the next situation that you look at for me is acknowledging the fact that everything that exists in the world is made out of energy.
Correct.
You know, whether it's a hard substance or it's a gas, it's still energetic, and it's just a shift in the energy itself. It's either, you know, something that's compact and dense, but it's still moving, it still has vibration, or something that is live, flowing fluid, or let's say in a gaseous, and we can even take it to a spirit state, right? Mm-hmm. It still exists. It still has vibration. It can be recorded. It can be identified. It can be looked at. So what we're dealing with, at least from my perspective, is how the body works in a sense of energetic balance. Is that arguable to start from?
Yeah, absolutely. And essentially, when we are not in balance, the body will do its best, just like we know there's that innate healing power to heal it. It's going to do its best to put out those symptoms that says something's not right here. This is a red flag. We got to do something about this before it starts to lead into, you know, disease and malfunction and everything. So yeah, that's what we need to pay attention to.
You know, we've talked many times with different patients. The patient comes in and they're very depleted. They don't have energy. And subsequently what happens is that if we do some of the things that we normally would do in similar conditions, they're destined to fail because you have to repair and rebuild that energy. So even if you use, let's say, in homeopathic preparations, there are many different types of treatments and remedies. But you have to, when the body's completely depleted, as in an acupuncture, you have to go gently. You have to begin to slowly, step by step, bring the core up. Where do you start? How do you know what not to give, how not to overwhelm, how not to, because obviously you use both systems for acute chronic conditions. We can use them for detoxification. We can use them to stabilize the emotion of the body, the Shen. We can do a lot of different things like that. So where do you start with this? There's a tremendous amount of confusion for people who are just playing with either one of these areas.
Right, and that's a part of it too. The more complex you get into either one of these symptoms, whether you're looking at, from a homeopathy standpoint, going to your local health food store and saying, that little remedy sounds just like the cold I have right now, it's going to cure me, or, you know, using acupressure points instead of coming in for acupuncture to say, well, I'm stimulating the same point, so why would this not, you know, cure me? What you're really trying to do is figure out what is unique to that individual. In Chinese medicine, we talk about treating patterns, finding out what is unique to that person. Where are they right now? If they have a headache, do they get worse or better when they're cold or hot? Do they feel it on one side or the other? You want to find out the most specific so you come up with the best treatment for them, whether it be Chinese herbs or also the acupuncture points. With homeopathy, you can do the same thing, but you're relying more on that patient to tell you what is their experience about what's going on. And as a trained practitioner, you're trying to pick up on the little subtleties that maybe they're not picking up. When they're going, you know, we talk always about when people come in and say, you know, everything was okay until then. Well, then you got to explore what's then, and how does that affect the person? What is their experience, like in a case of a headache, when they're having that headache?
And what led up to that?
Exactly. So that's going to be different for every single person. So whether it's Chinese medicine or homeopathy, that individuality is what makes it so unique. And that's why when someone goes over to, pick up something that sounds like them, it may not be the exact thing for them. The more chronic, the more complex that case is, the more they need to work with somebody who's really going to kind of tear out that information. What makes them them?
This Wednesday evening, Dr. Stephanie Pina will be your host, your presenter, here at the Roselle Center for Healing. Obviously, she's going to be talking about energetic medicine, the comparison between traditional Chinese medicine and homeopathic medicine, both energetic, vibrational ways of affecting the body. And profoundly, we've used it in our practice for all the 37 years that I've been in, and obviously they've been around in one form or the other for thousands of years. And we see today's application. I want to talk to you a little bit about laser therapy because it's basically the same thing with the right frequencies and the like. So there's a lot of offshoots of that. Mm-hmm. But if you'd like to attend Dr. Pina's presentation, please give us a call, 703-698-7117, 703-698-7117. Tell my staff that you'd like to be here. Remember, all of our in-house continuing education programs are a gift to the community. You're welcome to come. The only thing that we request and require from you is a reservation, and one that we can confirm with you, so you're going to, you'll be with us and we can prepare for you. 703-698-7117. That's how you do that. Let's talk a little bit about that. Let's go back to the core, the essence of what we're dealing with, because in a case of any disease process, whether it's cancer, whether it's an ulcerative colitis condition, we treat them in certain ways. Docs go in, in the medical community, they want to use steroids, they want to use antibiotics, they want to treat the symptomological representation of that, but unfortunately what happens, it progresses, it just gets worse, and they continue to knock out the immune reaction, which was the thing that allowed it to springboard to begin with. And we know that there are balances within the body, and that's a topic for another day. But the breakdown in energy, the breakdown in the vibrational spin of the atoms, the energetics that are present is really what predisposes the body to all of this. How do you explain that to a patient who says, this is hocus pocus, this is, the body doesn't work that way, this, and obviously you and I have to deal with that every day.
Well, it's amazing. Most of the time when you even bring up homeopathy, the hocus pocus part comes up. I don't think you can do an internet search on homeopathy without seeing, 5 negative articles and 1 positive article. Right. So it's we'll have to address that part too, which we'll definitely do in the lecture. The energetics, and we talked about this, I think the last time we did the large Ageless Health lecture too. We are all energy. Whether you call it vital force or chi or prana, or when you look at it, there's something that's keeping us alive. And essentially when that's off, it's going to start showing symptoms. And if you're paying attention to the symptoms, your body will start repair itself. And when you have symptoms that don't show up right away, and all of a sudden you're going into the doctor, and there's been years of, eating bad, not sleeping, being stressed out, your body almost forgets how to show you those symptoms because you've just ignored it. So what tends to happen is that we need to pay attention to those and start revitalizing that vital force, make it stronger so they can even bring out more symptoms later on. So some people, sometimes they'll call it a healing crisis. They don't exactly like when they get sick afterwards. They start their healing process, but it's their body's way of saying there's more to me than what's going on. There's more than meets the eye.
Let me step up to the plate and start doing something that I should have been doing a long time ago and get my strength back. But what it's doing, it's dumping toxins. It's getting rid of bad tissue. It's trying to repair the body and get it back to a place where it is doing what it was meant to do, and from birth all the way through. The vibrational medicine is incredible. We use very high-powered magnets in the office to test things. We also use them in Chinese medicine to put over acupuncture points. We use stimulation of sound to have an effect. People can experience this by themselves. Listen to a piece of music that's like cats squealing in the alley and fingernails scratching on the woodwork. It makes you cringe. You want to get as far away from it as fast as you possibly can. And if you were around it for any period of time, your body actually would succumb, and it's measurable. I mean, you can put electrodes up to people and watch the neurological patterns become aberrant. The same thing happens with environment, and this is where homeopathic and Chinese medicine come into. If the environment is not supportive, it causes a shift in the vibrational level of the body, so the body's ability, we can call it constitution, isn't capable of hanging on.
Mm-hmm. Absolutely. And what's amazing is, it goes back to when you're looking at structural, chemical, emotional, or any of the treatment modalities, what we're all trying to do is essentially stimulate that force, get it going, and go from there.
We're coming up to a break pretty quickly. My guest in studio today, Dr. Stephanie Pina, will be your host, your presenter at the Roselle Center for Healing this Wednesday evening, the 5th of February already at 7:30 p.m. She's going to be talking about vibrational medicine. What a beautiful topic, and one to really understand if you want to heal yourself. Give us a call at 703-698-7117 and tell my staff you'd like to be there. We'll be right back after some very important messages. Don't go away.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, waiting for your phone calls. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind, and we can handle it even from the topic that we're talking about today. Energetic medicine, the comparison between homeopathic medicine, which started in Germany under a guy by the name of Samuel Hahnemann, and Hahnemann. You know what? I'm not German, so give me a break here, Dr. Pina. Anyway, and traditional Chinese medicine, but it's a very interesting subject, one that we've looked at and compared relative to every patient that walks in the office. For all the years that we've been in practice, we do what we do with those tools as well as many other things. But Dr. Pina obviously is an expert. And by the way, if you'd like to read her paper, go online and you find it there. And I was wrong; it was written more than a year or so ago. But it's called Homeopathy and Chinese Medicine as Integrative Medicine, and you can just do a search on homeopathic medicine and Chinese medicine. It'll come up, and it's there, and it's quite significant. I think that you'll really appreciate it. But nevertheless, you can hear her personally this Wednesday evening, the 5th of the month, at the Roselle Center for Healing, and just give us a call, 703-698-7117. Let's explore this further, my friend. When a patient comes in, and we talked a little bit about the vibrational essences being depleted, so people get sick, or they get altered. They get like scattered electricity, like static on a television screen or a computer screen, and they're not working. So the idea is to rebalance the energetics, both in acupuncture and the energy that flows in the different meridians, or through the body's cellular system and the tissue levels in homeopathic preparations, because the essence is essentially the same. How do you do that? How do you make the decision of where to start with people in either venue?
Well, it's interesting. I remember when I was in naturopathic school, it was funny. There was, when you're in clinical shifts, there was a homeopathy shift and there was a Chinese medicine shift. And a patient would go to one, and basically the two physicians that were running the shifts did not interconnect the two. If you were a homeopathic patient, you went to homeopathy. If you were a Chinese medicine patient, you went to Chinese medicine. They didn't see that connect. I'm not kind of in that group. I kind of like to use them together because a lot of the times when you see that either a patient's not progressing the way they want or there's something else that's a little bit deeper that you're feeling like you're not quite getting hold of, that's where the other type of medicine does a really good job. A lot of people come in for, I'd say about 80% of people come in for Chinese medicine, mainly acupuncture for pain syndromes. So they think of the physical side of it. But we know that Chinese medicine can address the mental emotional side. We know that those are probably connected as well, too, because if the pain gets up to a high enough, it's going to affect us physically and mentally because we're not going to be able to function. Homeopathy, on the other hand, always gets this idea of being used, when there's this mental emotional side of it all the time. But at the same time, you use some of the person's physical characteristics, even their tongue and their pulse, which is essential to Chinese medicine, as ways of confirming which remedy you use. So to me as a practitioner, if they're coming in for acupuncture, first of all, you're going to lead that way. But the good thing about a Chinese medicine intake is you're looking at every aspect of their life. It's very similar to a homeopathic intake. You're just not pushing as deeply into the kind of the strange and new sensations that they're trying to have. If something comes out, someone always says, I'm really hot all the time. I love to stick my feet out from under the covers. And you're going, well, that's kind of weird. Not everybody. Like, when you just pull the covers off if you're hot, they go, no, just my feet. That's something that triggers my homeopathic mind going, there's something more here. And do I combine it with their acupuncture right now, or do I let that develop and see if anything else comes up more? So sometimes you put the two of them together right away. Sometimes you try to see what else the patient's going to kind of bring forth to you. And if it starts to go one way or the other, you start kind of going, let's look at a couple of remedies.
Now, what I want to get into with you in the next half of the program is constitutional types, because that's really gets the core of homeopathic applications. And so many of the things that we see out in the different stores, Moms or Whole Foods and so forth, are basically treatments of acute symptomological presentations. But a traditional homeopath loses his mind or her mind and says that's not where you go with these things. The problem is when you give a constitutional type remedy, it takes a long time to repair the system unless there are other things, in my opinion, that are being done at the same time to substantively enhance the body's capacity to deal with that.
Correct. And the other thing that drives a classical homeopath crazy is, if you're doing more than one thing at once, because you don't want to see the effects of anything else, then you're going to get confused. Well, was it this remedy or that remedy or a new, supplement or something like that? So they'll get very protective over that. And then the combined remedies, when you have a product that says, cold and flu, and there's 6 different remedies on there, everything's at a very small dose so that your body has that chance to possibly react to one of those 6 remedies. So you're really focusing on that.
See, my brain says more is better, but that's a discussion for a different day and a different topic. We're coming up to a break. We have the news and some very important information. My guest in studio, Dr. Stephanie Pina, be your host this Wednesday evening, the 5th of the month. Don't go away. We'll be right back with much more information.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, waiting for your phone calls. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We have an interesting one. We're talking about energetic medicine and how it affects your body, and we have an expert, Dr. Stephanie Pina. We're comparing Oriental traditional medicine, traditional Chinese medicine, to homeopathic medicine because they both deal with the body's levels of vibration. And there's much crossover there, just two different ways of approaching the same thing, but we have other ways of stimulating that as well. And we're going to talk on a couple different levels in this part of the show, but I would love to talk to you. Dr. Pina is going to present this Wednesday evening, the 5th, at the Roselle Center for Healing, this specific topic area. We'd love to have you here as our guest. As always, these programs are our gift to the community. All you need to do is call 703-698-7117. Tell my staff you'd like to be with us, and we'll be here to say hey, and you'll learn a lot, as you always do, from these very talented practitioners that I have at the center. Dr. Pina, let's talk a little bit about what we mentioned just before the break is the constitutional types, because so many times somebody goes out and they get a remedy for whatever it is, right? And for example, oxacillium we're using a lot of right now for the flu, but they say, well, it didn't help me, it didn't work. There's a constitution that has been misadapted at that point, and in traditional homeopathic preparations, there's a constitutionality, a constitutional type, and there's 3 of them. So where do you start? Do you use the remedy? Some homeopaths said never use the remedy, go to only treat the constitution, and there's that controversy. What say you?
This is why it keeps going back and forth, because I think what tends to happen is that you really have to see what's going on with that patient in front of you. Where are they? And again, you're trying to pick what's the best medicine overall for the patient. When you start looking at the constitutional types, and then you can also, there's other systems as well too where they break it down. Is this person, they call it by the kingdoms, are they more a plant type based person or an animal person or a mineral person, which is much more of like there's a homeopath that's coming out of India that usually uses that type of system. You're looking kind of like you're trying to make a clean slate of the person and pull together what is just normal about this person. Like, okay, they have headaches. What do you see before them, or with the colds? What seems like it would normally be a cold and what's not? That is their constitution coming through. It's the most particular weird symptoms that you can possibly find, instead of it being the big symptoms. I get a fever. Okay, you can look up fever in homeopathic medicine. You'll see 5,000 remedies. Okay, we know we can't use that one. And individual symptoms, even when you're talking to the patient, even has a weight amongst itself. You can put things to be more strong. You can basically kind of break down things so that you really want to see what's the essence of the person in front of you. Why are they breaking down? Why are they not healing the way that they should? And individual remedies that sometimes you can find over the counter just aren't the right way to do it because it's not specific enough.
Isn't that similar to what we see, and I touched upon it in the first half of the show, is that a patient comes in and they have whatever condition they happen to be bugged by, and we look at them multidimensionally as we do in our practice. And what we see with this patient is that this patient doesn't have the energy to heal with. And so whether we give them a homeopathic treatment, or we give them a chiropractic treatment, or combine the two, or do detoxification, sometimes we have to be careful with that patient, because if we don't realize that they're energetically deficient, depleted, that we can actually make them worse. Mm-hmm. And that's the basis of what we're talking about. I want to get back to that, but we do have some callers, and I'd like to get to at least one of them. Diane, thank you for calling. How can we help you? Hello? I don't think she's there.
Uh-oh.
So it was a question on ulcerative colitis, but we'll get back to that.
Well, I think what's also interesting about whether we're discussing Chinese medicine or homeopathy, some of these same principles, the individualized care, looking for the symptoms, treating the whole body, waiting for the symptoms to kind of express themselves to kind of say if you're going in the right or wrong direction, and getting the patient's feedback to know if you're doing the right thing for them and if they're feeling better or if they're not. You know, there's some of the same things that come up no matter what kind of holistic care you're actually giving, and some of the same questions that get raised in every single modality. And that's what's kind of funny thing when I was getting ready for this particular radio show. I was sitting there going, you know, change out the modality and you'd be asking yourself some of those same symptoms, some of those same questions. It's the same things over and over again, but instead of giving an acupuncture needle or a Chinese herb, I'm giving a little remedy and often what people call is the little sugar pill or in water. Or is it, you know, vitamin B? You know, I mean, it's the same thing. Your body has that reaction to it. It has an affinity to it, and what it really is doing is trying to survive. Our body will try to survive. When we talk a lot about homeopathy in the small and minute doses, there's a great example of sharks in the ocean. You know, you drop one little thing of blood or a little bit of blood into this huge ocean, and that shark's going to find that wherever that animal is because
about a mile away.
Yeah, it's an innate survival. It's that sensitive. So we're trying to find those things, the right modalities, no matter what it is, that's going to get into that, just like that shark's mind. We want to give them the blood, basically.
See, this is how I relate the constitutional types to. We talk about a person's constitution, and in Western medicine, which is different but very similar to the person's constitution in homeopathic preparations. When you say somebody's got strong constitution, that means that you're giving them the acknowledgement that they probably have the strength to be able to turn whatever condition is around and make themselves better. If you, in Chinese medicine, we'll say they have strong kidney qi. And that's one of the things that you want to see because of the kidney qi, which is what we look as life force, life-giving in traditional Chinese medicine. If that's not substantive, then no matter what you do, nothing else is going to hold or balance. So the same thing is a crossover, I think, in homeopathic preparations, that they're looking for that constitution, that pattern that is innate to that individual to try to repair that. And we're all different. We all have different blood types. We all, resonate to, different types of situations, right or wrong.
Correct. And in some cases, one day we're different from the next day. But some of our constitutions stay the same. So you can always go back to that constitution and see how the person responds. And maybe the remedy changes, maybe the dose changes. But like you're saying earlier, when you're seeing a classical homeopath and they're really doing a case study on you, it's almost like a psychological interview because, like I said, they're digging down deep. They want to know everything. They'll keep asking you, oh, you like chocolate? Why is it? What is it about chocolate? And you're going, well, I just like chocolate. Why do you like chocolate? I mean, it's almost like an aggravation. I've been through them, and they're not fun.
No, it's
you're like, give it up. Let's move on.
It's an interrogation.
It is. It's totally a psychological interrogation. But what they're trying to do is pull out more stuff, and the more specific, the better. But no matter what you're doing, it's got to be individualized. That's why when you look at the big masses and the kind of the idea of, there's a homeopathic cure for the next big plague and stuff like that, certain people will respond to it because they have that frequency that's going to refer it. The energetics are there. Their constitution is strong enough to fight it to begin with.
Everything is individualistic.
Exactly.
And if you don't apply the right cure, the right formula, it's like anything else.
Yeah.
There are patients that come in that need treatment. They're hurting. They have degenerative conditions. But if you do the same thing for every patient, if you do it in the same combination, you're going to get different results. People are not going to respond adequately. So, when you look at qi, energy, when you look at homeopathy, energy, when you look at the body's essence, which is energetic, you have to look at what's unique about that for the patients. That was what we try to do. This Wednesday evening, Dr. Pina is going to discuss these things in detail. And if you'd like to know really how it works, why it works, and why sometimes you try a homeopathic preparation and it doesn't work, this is an opportunity to really find out about it. Just give us a call, 703-698-7117, and tell my staff that you'd like to attend this Wednesday's presentation and ask Dr. Pina any question that you may have. I think it would be a very fascinating topic, one that you will definitely go away with a lot of information from. Let's go back to the phones. Diana, are you still there?
Yes, I am.
How can we help you, my friend?
I was calling to ask how acupuncture could help ulcerated colitis?
Good question, Diane. Matter of fact, I'll let Dr. Pina jump into this primarily. One of my first patients when I was a intern in the clinic was a young man who had very, very severe ulcerative colitis. He was bleeding profusely. He had something up to the neighborhood of 30 to 40 bowel movements a day, and the man was on the way out. But Dr. Pina, go ahead.
Well, energetically, you can always look at the spleen and the stomach are kind of what makes up the entire digestive tract in Chinese medicine. So if there's inflammation and mucus formation and basically the body is angry in the digestive tract and it's trying to get stuff out, decreasing inflammation first can be one of the main things. Improving blood flow to the gut to allow it to heal and absorb nutrients is going to be one of the main things. But, of course, since it's a digestional issue, you have to go into the digestion itself. What's the person eating? Are there aggravating factors? What else can you do to help support the system, as well as doing acupuncture needles too? Locally, I've gone in there and used some acupuncture points over what seems like the intestines and stuff on the abdomen, and they'll go bright red. The patient will even say it gets really, really itchy and stuff because that's that heat and inflammation coming out. So you could do a lot of local things, but in order to treat a disease, especially like ulcerative colitis, you have to look at it's a complex disease, so it's going to require a complex solution as well.
The guy that I was talking about that when I was an intern that we treated, I didn't know a fraction of what I know today, but what I did know in those days was acupuncture, and that was the only thing that was able to help him. And we didn't have the effect that we could have today, but we brought him down to the place where, he went from, as I said, 40 bowel movements a day down to maybe 7 or 8, and the blood show was something that came occasionally and not every day, and he was able to start putting some weight back on. But as you said, dietary considerations, allergy reactions, neurogenic influences to the bowel and so forth, all those things have to be taken into consideration, and if you don't, you're not going to be successful.
One of the main things, too, is when I have patients come in, whether it's for a digestive issue or something especially that's been chronic and is kind of complex, is that treatment needs to build up on itself. So while you're doing all these other changes that are going to take time, acupuncture is there also as a support role. So it's not the only thing. And with Chinese herbs, sometimes we'll give those because essentially those herbs are going to have contact to that actual tissue versus the needles aren't going to go all the way to the gut itself. But those herbs can kind of get down in there and help some of the inflammation locally, too, just by contact.
Yeah, and you have to because there are many triggering mechanisms that are associated with any of these conditions, particularly in the gut and the bowel. When you realize that the intestinal tract is 75 to 80% of the body's immune system to begin with, and when that environment is not balanced properly, that there's parasites, there's bugs that live there. And, people say, oh, my God, parasites. Well, 60% of the population has parasites. Mm-hmm. And, if you let those things live and flourish within you, they damage the body. But if the body's, some people get exposed to anything, and they never come up with anything. They just seem to be impervious to, any slings and arrows from a day-to-day situation. And they live well, and, they die at 100 years old in their sleep, never having, and they've abused themselves. And that's the amazing thing. We all know them, somebody who's just been bad their whole life, and all of a sudden, one night they close their eyes and they're done. They leave the planet. But that's what we call their constitution. They just seem to be, they have more energy balance. And some of these folks come in, and we do an occugraph on everybody that walks in the office. And I see people who are in their 70s and 80s, and you do this occugraph, and their energy is off the top. I mean, it's amazing. And you get somebody in their 30s and 40s, and their energy is around their toenails. And you can see the difference at that point of what their constitution, their energy, their platform really is.
Mm-hmm. Absolutely.
So on Wednesday evening, I know you're going to kind of dissect this topic, and you're going to go through it piece by piece. There's not too many people that I know that have an appreciation and understanding of the combination of traditional Chinese medicine and homeopathic applications as you do. Obviously, you've not only spoken on it, but you've published on it, and you can get into the intimacies. But let's talk a little bit about the patient who comes to you, and they like our last caller, Diane, was talking about ulcerative colitis. So if you wanted to work her through from acupuncture and homeopathy, what would you have to know about her? This is a significant, serious condition. So, how is it? Can you be effective with her? Is it something that's just symptomatic, or would the combination of the two things actually make a huge difference and perhaps solve the problem?
I think it's, like I said, when we were talking about how there's multiple factors in this, you do look at it from a number of different perspectives. What becomes interesting as far as when you use both in this particular case too is that you're not there to necessarily treat the symptoms. You're using the symptoms as a guide. How is that body going to respond? If you're seeing changes from their physical standpoint, maybe you do something physical like an acupuncture. That body says, I respond physically. You have to give it that physical stimulation. If she's responding emotionally, a lot of times, like if we have patients that in one case comes in with constipation, they're actually holding those emotions inside. They're not letting the bowels move and they're not letting their emotions move. If you see that their emotions start to break down, you know you're going to make a change in the digestive process because they're letting go and they're releasing. So weird description of it, but it works.
Yeah, got it. I understand. I think everybody else did too.
Hey, you can see it. It makes sense, right? So, but when you're working with someone, you kind of let them guide you. You have to take sometimes your experience out of it and just let things go. You want to see what they've obviously done in the past and do a good medical uptake to understand, what medications are on, what they've taken, what they've done and haven't done that's worked and haven't worked for them. But then you have to kind of see and sit back and go, what is this person not telling me, and why is that the reason why they haven't been healing overall?
Yeah, it's important that you get the why is that, when was it first started, what happened before that, and dig back as far as you possibly can. So many of these things start even at birth, and the influences and the pass-throughs from the mother genetically, which is a topic that, we should get into very in-depth. However, we are coming up to a break, and we have to pay attention and respect to some of the people that bring you Dr. Tom Roselle live. So Dr. Stephanie Pina will be your presenter Wednesday night. We do have a couple calls, and we're going to take that as soon as we return. Don't go away. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. Love to take your phone calls anytime, whether we're here or whether at the office. You can give us a call, 703-698-7117. That's how you register for Dr. Stephanie Pina's presentation on the intimacies and the overlaps between homeopathic medicine and traditional Chinese medicine. What is she going to be talking about, really? Energetic medicine, how your vibration, when it goes bad, makes you sick, and when it's working the way it's supposed to in harmony, you stay strong, you stay well, you seem to be impervious to anything that takes place. So we'd love to have you as our guest. All you need to do is give us a call, 703-698-7117, and tell my staff you'd like to be with us. Let's go back to the phones. Richard, are you still hanging?
Yes, sir. Yes, sir.
How can we help you, my friend?
Just a quick question. It's a little bit off topic, but the use of alcoholic beverages, could you all comment on that? I've heard that the darker the red wine, the better it is for you. Does that in any way offset the fact that you're consuming poison?
Well, that's called the double-edged sword of many things in our life. So, there's this rule that we call the 85%, 15% rule. 85% of the time, if you're really good and you take care of yourself, you can suffer a little dent in the armor 15% of the time. But here's the truth about it is, alcohol, and let's just talk about wine, because grain alcohols and other types of liqueurs and so forth is not about what we're about to say. Red wine specifically has very, very high levels of antioxidants, and if it's an organic wine, it hasn't been loaded up with all kinds of pesticides and so forth. In moderation, it can be very supportive to you. Now, if you're having a glass of wine a night with your dinner, and your dinner is made up of vegetables and good proteins, and your grains that you're having are things like wild rice and a little bit of brown rice, it's probably not going to cause you any problem unless you have sensitivity or an allergy to the wine, or you already have liver function problems where you shouldn't be processing the alcohol anyway. So, but if you're drinking several glasses of wine a night, I would beg to argue that there's a problem there, and it's more than just, part of your diet. So you have to look at the individual, you have to look to see what they're sensitive to, and you have to see what the effect is in other areas of their system. So the short end of that answer is it can be supportive because of its antioxidant levels, and it can be destructive if you have a sensitivity to it, or you have organ systems in your body that can't process the alcohol. You want to be careful of sugar levels. If you're a mold or fungus patient, alcohol is not something you should ever touch because it converts into sugar very rapidly in the body. So, again, we're just touching on the surface. If you don't have enough B complex and chromium and zinc and so forth, that can be an issue as well, because now you're further depleting the body. But it's all based on a balance of lifestyle, and the good guys and the bad guys combined.
It's kind of funny, in Chinese medicine, they don't use a lot of alcohol in their tinctures, like in their herbal preparations. You just don't see it. It's always been in tea form most of the time with the raw herbs. And then nowadays, granulars and pills. But they used to look at it as a blood mover. So I think they were recognizing the antioxidant effect, too, that it could actually move things through the body. So they used it to help process things, but they certainly weren't using it a lot, that's for sure. And some of the herbs that they use now that go to affect the liver can actually help break down alcohol. There's some Chinese herbs that people will take before they actually go drinking, if they know they're going to be in excess. That's a different topic for a different day. But
Excess is never a good thing for anybody, because your body has to stay in harmony and balance. I had a great aunt that lived in Sicily her entire life, and she died at 100 years old in her sleep. And at lunch and at dinner time, she'd always have a small glass of wine with her meals. But she worked hard every day, and she had way less gray hair in her hair than I do now, and her face was clear and so forth. But it was a combination of lifestyle. It wasn't just about the fact that she had a glass of wine, and it was things that they made fresh every day, but it was the balance of the vegetables and the nuts and the fruits and the little small pieces of meats and so forth. That's what she was all about. So it's a balancing act. This Wednesday evening, we'd love to have you here in the office as our guest. This is a fascinating topic, and one that Dr. Pina and I could go back and forth with probably for the rest of the afternoon. And it weaves itself into so many different types of realizations about how the body works and how we relate to our environment, our energy. You'll hear people say, that I can feel that. It vibrates the right way for me. And, they're telling you something. The body is expressing an application.
Absolutely. Like homeopathy and Chinese medicine, they look like two different things, but they're actually very similar. We're going to go into that and kind of say what the similarities are. We're going to also go into, the real down basics of homeopathy that, some people get little aspects of it and they worry about how small of a dose is this. That's makes it so much of a that's so much more of an less of an issue in the long run than what's actually going on in the body. So we'll basically be able to go through all that.
It's an exciting topic, and I love listening, to anybody that knows something about it. And obviously, you are an expert in the area. You've spent a lot of time really exploring the intimacies of it. We've got to end the program, unfortunately. I'd love to do this all day long. It's a great topic, but we'll be here next week, same time, same old place on your dial. This is Dr. Tom Roselle. Thanks for listening. See you then. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of SOFTOUCH Dental Care and Dr. Michael Chung. SOFTOUCH Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Ooh.